Everyone to the fifth webinar in our webinar series, Complexity Theory for Better Child Protection and Welfare and Public Services. Our theme today is Complexity Theory and Children's Participation, and it's a very apt theme on World Children's Day. So thanks today for joining us, everyone. My name is Aisling Gillen. I work with the UNESCO Child and Family Research Centre, which is part of the Institute for Life Course and Society at the University of Galway. And I'm joined today by Dr. Carmel Devaney, who is Associate Director with the UNESCO Child and Family Research Centre. And I'm also joined by my colleague Gillian Brown from the UNESCO Centre, whom I want to thank profusely for organising this webinar series so well. Carmel will act as moderator for today's webinar. Our keynote speaker for this webinar on complexity theory and children's participation is Samia Mikhail, a lecturer in social work at the School of Social Sciences at Western Sydney University, Australia. Samia is kindly joining us at what is a very late hour from Sydney, and we're deeply appreciative of that, Samia. Thank you very much. Samia has over 30 years' experience in direct service provision, management and leadership roles in government and academia across a range of universities. She is particularly interested in children's well-being and their participatory rights. Samia's current research is in the application of complexity theory to care and protection. We encountered Samia's work in the Centre in the context of the writing of her forthcoming book with Routledge, Systems, Complexity in Child Protection and Welfare, Policy, Leadership, Practice and Evaluation. Samia argues in her work for a focus on complexity absorption, collective sharing, and multiple creative practices in relation to participatory practice with children and young people. So we're very much looking forward to what Samia has to say today. Our respondent today is Dr. Caroline Dignan. Welcome, Caroline. Caroline is coordinator of the Roscommon Children and Young People's Services Committee for the past 10 years. Caroline is a professionally qualified social worker, and a big congratulations to yourself, Caroline, as you've recently graduated with your PhD from the University of Galway on the subject of exploring the operation of power structures, relations and process within the context of strategic collaborative working for children and young people. So no doubt you'll be reflecting on that research in your response today. The format of this webinar is that Samia will speak for approximately 30 minutes and Caroline will respond for about 15. Dr. Carmel Devaney will act as moderator and will facilitate questions and answers at the end. So I'll now pass you over to Carmel.
Thank you, Aisling, and good afternoon to everyone. You're very welcome. And on behalf of the Research Centre and the Discipline of Applied Social Science here at the University, I want to thank you all for attending. I want to thank also Aisling for all her work and also Gillian, as Aisling mentioned. And a big thanks in particular to Samia and Caroline, our presenters today. So I have the easy job, as Aisling mentioned. I'm the moderator, so I just need to keep everything on track. And also I am going to moderate the questions and discussion at the end. So just as a reminder to pop any questions you have into the Q&A function, and we'll get to them towards the end of the session. So I'm going to hand you over to Samia now, and I've no doubt we'll have an interesting hour ahead.
Thank you, Carmel. So happy World Children's Day to everyone. It is an important day and it is apt that we're talking about children's protection and participation today. And it's important that we continue that work that started over 35 years ago, although we live in a very different context. And we are thinking, of course, more and more about the complexity of child protection work and what it means for children to have a voice in that work. I'll start briefly with some context and then say a few words about maybe why children's participation in child protection is a complex area, and then end with that discussion of complexity absorption with some examples about the ways in which we can embrace the chaos and improve the way we organise to protect children. So I've just started my slides there. I hope you can all see those.
Yeah, all fine, Samia.
Thank you. So here in Australia, New South Wales, the child protection system reflects a neoliberal ideology and a favouring of hyper-individualism, where government seeks to really transfer the control of economic factors to the private sector and private enterprise. We have a state paternalism value position of child welfare policy, but after ratifying the convention in 1989, children's participation rights were legislated in child protection laws in 2001. And slightly different, I think, to the European context where we don't have legislated children's rights in any other area of child welfare. So this was seen as quite a significant shift in ideology. About 10 years later, in 2010, following several royal commissions and reviews, out of home care services shifted to the community sector, but without the equal measure of control of funding. And then soon after that, in 2013, we had our first National Children's Commissioner. We now have a child protection crisis where we're significantly understaffed, and of course, many seeking refuge in abolitionist views wanting to do away with the entire concept of a child protection system. But of course, 35 years on from the convention, as we're remembering today, we have a history of increasing awareness of children's rights and a more recent history of global and national movements by children and young people wanting to disrupt policy. So, of course, we have Greta Thunberg as an environmental activist on climate change who spoke at the UN Climate Action Summit at the age of 16 in 2019. We have Malala Yousafzai, an education activist who was the Nobel Peace Prize laureate in 2014 at the age of 17. And closer to my home, we have Grace Tame in Australia, who is a child sex abuse activist who became the 2021 Australian of the Year at the age of 21 for her age, for her work on encouraging young people to speak about sexual abuse. Well, many of you have young people that you may live with or know who regularly advocate for their rights, maybe around the chores that they prefer to do and other things. But for children and young people who sit below the traditional working class due to the ineligibility or precariousness of employment and living conditions, they're a group often resource poor, struggle to connect with schools or education, and become a focal point for official interventions that may be punitive and/or therapeutic or medical, as those macro social causes of poor well-being are ignored. And of course, we know from the literature around the world that overall children and young people are not satisfied with their experiences of policy. And it seems that children and young people themselves are now also driving progress for their rights. So there's a complexity and a changing landscape of social work, and it has a bearing on the difficulties that are part of our work when we seek to ensure children and young people participate in decision making. What do we do? What happens when we have difficult decisions to make in an increasingly complex environment? Our response can be aimed at wanting to reduce or simplify that complexity. We might, for example, prioritise permanency and seek to place children in care as the more linear response. We may seem to ignore some of the degree of the complexity of the work that's needed. We may not explore in depth the views of young people, family members, or cultural connection. We might also seek to manage the complexity by containing the risk, gathering evidence, usually forensic, and basing our decision on psychological assessments or other expert recommendations. However, a complexity theory-informed approach utilises the chaos, and it might offer a way forward for us to more specifically approach child protection in a way that's responsive. And that necessitates children's participation to drive that sort of practice. And that means absorbing the complexity, not reducing it, avoiding it, or managing it, or any combination of those responses. And of course, I will say more about those ideas a little later. You can see here some quotes from some recent research we've done that reflect what people personally and professionally think about children. And that really matters here because they're inextricably linked to each other. So, of course, we have long-standing social constructions of children's voices as problematic, and these still exist, and we can name some of those. Children's views are less valuable than adults because they have less capacity to understand the world, or children's views are difficult and time-consuming to obtain. But maybe the more recent and interesting social construction is the perception that children's views complexify an already complex system, and that the system doesn't know what to do with these children's voices in the face of that complexity. Children's participation is influenced not only by the way we construct children, but also where we're located in a system or institution, because this impacts the way we understand the actions that lead to children being part of decision making. So, what is our role in the system? Are we working alone? What's our understanding of the function of policy? What is our relation to risk? Are we positioned to work predictably or creatively? And often, of course, participation models seek to reduce participation to a set of processes or elements that imply that if these are followed or considered, that participation will result. Are we able to resist the traditional elements that are often ingrained in systems? For example, linear supervision and management lines that may pre-program our thinking into pre-established practice pathways or strategies, and not in new or networked and connected ways that might need to emerge. So based on where we are doing our work and what experiences, knowledge, skills, and attitudes we have, we come to have different understandings of participation, what it is, and these definitions compete with each other and the definitions of other stakeholders within the system that we work. This all results in child protection decision-making being burdensome and practitioners being ambivalent about operationalising participation. So I want to just talk a little bit about these 4 dimensions and describe them briefly. And they're dimensions that progress dialogue on child participation from a focus on why it's important for children to participate to one that says, how might this be achieved in practice settings? To a more nuanced discussion on the multi-layered levels of influence in determining how child and youth participation can be successfully embedded. The 4 dimensions are related to where participation is located, and therefore they implicate what might be required in that particular setting or context. In that way, the dimensions offer an alternative non-linear description of the policy to practice gap, or more precisely, policy to practice gaps. The centre of both the axes is intended to represent participation as multi-locational, and that there's no corresponding organisational system counterpart for this overlap of dimensions. I'll just do that so you can see that. So if we look at the personal procedural dimension there, this is about the competency of the adult to interact with the children in age-appropriate relationship-based ways. And often participation is referred to or described in terms of that particular skill set or that particular dimension. But there is also a public procedural dimension, which is around the structured ways of engaging with children, the formal system of resources, the infrastructure, the policy tools designed to support direct work with children. There is, of course, our own personal conceptual dimension, which is those individual internalized attitudes, beliefs, tacit understandings, the ideologies, of course, we hold about children, and often our gut feelings, things that we don't talk about. And finally, the 4th dimension is the public conceptual one that really embraces those theories about children's participation and the social norms towards childhood, a little bit like the neoliberal times in which we're living here in Australia. Now, of course, these dimensions of participation lead to distinctive conceptualizations and implementation strategies. So there becomes a sense of disconnect created if stakeholders and structures and processes are not networked, And there are no feedback loops between these dimensions. And what I mean here is that in terms of a feedback loop, this is where the output of one dimension is used as an input into the other dimensions. And we'll look at this again also in a little bit more detail later. So child protection decision-making is burdensome for 3 reasons. And of course, this is supported by the work, or this supports the work of Eileen Munro around decision-making under uncertainty in child protection. The first contributing factor is the scope and the scale of the determinations that we have to make. And they're aimed at resolving inconsistencies between the interest of the child, the family, the decision maker, and the system requirements. And practitioners are often left to straddle the professional and the personal demands on their ideas, to integrate complex information about culture, and to continually, I guess, repeatedly balance the risk with best interests of the child. The second is the critical nature of the decisions that are made. And all of these have very grave consequences. So we understand very clearly that some of the decisions we make on a daily basis will have long-term impacts for children and young people, families, and communities for generations to come. And so decision makers have very difficult choices to make. The third aspect, of course, is that decision makers, and this will come as no surprise, does have an emotional toll. So there is a personal investment, the self is impacted. And this aspect is less prominent in our discussions of why children's participation is difficult to implement in practice. The discomfort that often practitioners feel around the decision making is not always connected to the resistance to taking on children's views. So there is this distinct, as Cadell and Hislop and Woodman and others have said, there is a distinct uncertainty, and children bring a nebulous complicating factor that's difficult to integrate into the set of boundaries of the child protection system. And that uncertainty is often expressed in comments about political concerns, about legal mandates, about organisational culture, about best practice, or even about how we should go about meeting children's needs. So the combination of these aspects of decision-making creates this ambivalence about introducing children's participation alongside an anticipation that there will be decision errors if we speak to children. But of course, it's also these lived experiences of practitioners that can be the resistance to what I'm calling today or talking about today, which is complexity absorption. It's what we also need to use to build the system from the front line. And you can see here, this is also a quote from a very senior decision maker, you know, who is describing on what basis decisions are made. And it's clearly not the child's best interest, and it's clearly not what children and young people are experiencing. So we have 2 conundrums: how to mitigate the complexity of that decision-making burden, and how to bridge those epistemic differences around participation, all within a complex and rapidly changing context. And we want to do that to increase the chances that decision makers located anywhere in a complex system choose child participation as an embedded practice, whether that's frontline or policy work or research or in HR or security. And it seems that traditional management frameworks are weak in the face of both of those concerns. So I'll turn now to complexity absorption and talk about what are some of the ways that we might move forward to address those conundrums and welcome the chaos. And really, this is about suggesting that we can gain energy and momentum from the complexity, from the diversity of voices, from considering timing and context, use of power, located understandings of participation practice. We can shift to focusing on values and not rules, and essentially at times also following our gut to wherever that takes us. So it's about timing and action. acting at the right time, staying close to the child to know when to take that action. It's about context and situation, following the emerging situation and responding to it, not starting with a set of goals and activities, but having contacts and resources in parts of the system for strategic longer-term outcomes. And it's about efficacy, which is, again, that focusing on values and not rules, using knowledge about the current situation. So this is quite a different process from traditional management models. And within reason, there is less emphasis on formality, a focus on development and not outcomes, so process and not end goal. And there's an emergent situation that's not standard because every natural evolution must, by definition, come about in a new way. I want to take an analogy here of the digestive system, if you will, that makes food into fuel. What we ingest, so children's voices, their experiences, our ambivalence as practitioners, the context that we're in, must be digested before it can be moved into all of the cells of the system that are interacting together. Digestion needs to be slow and steady. Data shared, understood, explored, evaluated, critically reflected upon. And this is where skills are fostered. And then once it is absorbed, it can be assimilated more easily into the system. Complexity absorption requires what we've heard from children and young people to become our strategic outcomes. And so they can't be predetermined. This is literally living in chaos. Sticking a little further with the analogy, the increased variety of food that we ingest, the healthier our body systems. The same is true for child protection. There's a strength in ensuring diverse perspectives that can enrich the protection process by providing unique insights that reflect experiences and needs, ultimately leading to more effective, meaningful outcomes. Therefore, finding ways to engage with children and young people contributes to a complexity theory-informed approach, which then responds to the need for person-centered practice, trauma-informed approaches, biopsychosocial models of child and family work that together meet our ultimate social justice goals. So the emergence may be a reflective practice culture or many other different ways or new patterns of working. So I'm suggesting a bit of a discussion here about a range of ideas for working towards that complexity absorption. And I'm interested to hear your views about this at the end, because these require taking on unfamiliar roles and welcoming the emergence of new patterns of working. And many of these are based on ensuring there are feedback loops between structure, process, and stakeholders, that the system remains connected and networked. So to start, for example, exploring that contribution of competing epistemic differences, creating forums where there are or data brought together from practitioners, policymakers, middle management, children and young people, foster carers, and the diverse range of stakeholders. And this mitigates discussions remaining siloed in the system. But more importantly, it addresses difference and it opens a range of options, which may seem like complexifying because they're time consuming, but it's actually complexity that can be used to be responsive. We often can mistake the volume of decisions that we make and the time that it takes to make those decisions for complexity. So there is some sort of resistance to this sort of way of working. If we talk about the ambivalence that practitioners feel in decision making, we know that this becomes anxiety-driven practice around risk and uncertainty. And they're areas that remain that we can be more proactive about addressing. So, for example, recognizing that supervision occurs continually in many forms and utilizing the range of supervision forms as needed, whether that's group or peer supervision, formal and informal ways of being able to connect, and mainstreaming these spaces for critical reflection is really essential. What doesn't happen in terms of traditional management systems is that the discussions that occur in those supervision spaces remain in those spaces and are not shared more widely. And so they're not used in a food feedback loop. But the data that comes out of those discussions and those connections is crucial. And as we said earlier, to become a feedback loop means that that output needs to become the input for other discussions in other parts of the system. If we talk about distributed decision making, we can again think about focusing on the process of the decision making. We can expect failure. Risk is inherent in child protection. It is a difficult space. Failure must occur. We can't have a system that's only expecting positive outcomes for children and young people. So we need to move away from a culture of blame and relying on expertise in groups. And of course, where there are groups of experts coming together for this diffusion of decision making, there must be a strong element of reflexivity to avoid groupthink and to, of course, make sure that the decision making is in fact distributed. And the groups that are coming together making decisions should shift as needed. So diffusing management tasks as widely as possible can occur in horizontal structures so that there's a large number of agents or stakeholders that can participate in the task of organisational decision making. So essentially making sure that there is more than one centre. In the Finnish system, for example, I'd note an example where decision making has to be described and assessed from the perspective of the child or the young person and the family. And so informing the children and their families in a way that they can comprehend means that decision making is actually explored, it is broken down, it is understood, and it is very clear how that decision has come about. In another example I've put in my paper here from Australia is the study of environment on Aboriginal resilience and child health. And in that project, leadership is regarded as shared. So there's a regular coming together of experts in diverse areas, but it's also marked by equal partnerships. And that requires risk-taking from each decision maker. There is no focal point. And what emerges, or what has emerged in this project from the ground up, is a community-driven longitudinal program. But most importantly, the health targets, the methodology, and the administrative process are unspecified. So it builds trusting relationships and tangible outcomes because of its capacity to negotiate the different interpretations and adapt to the changes that are occurring in the community in real time. The next idea is also about horizontal structures, but horizontal structures with children and young people. And I won't say too much here. Power is discussed by Carmel Dugnan in her PhD, and thank you for that work. And of course, power is a crucial element of systems. And needless to say that children and young people have power, as I gave examples earlier, but we underutilize those in child protection decisions. And that can be because participation is a political process. It's a political action that prioritizes the voice of the child. It raises their status as an active member of society and raises awareness of their human rights that often are breached. So children and young people who are excluded from participation are also excluded from protection. So they must be present in our systems and structures. And so that means really dealing with this issue of power and recognizing that we are acting in a political way when we include children and young people. The next point is on critical reflection, and here I just want to point out that this can be in and on action, and I'm referring to Sean's work, of course. And reflection in action is as it's happening. And this provides a flexibility and an ongoing flexibility in real time. Reflection on action is after the event. And this is where we make meaning of the data and the voices that we've heard and the practice that we've engaged with. But we need both in action while we're working and on action after the work reflection. On action reflection doesn't support change in real time and it's not as potent. And of course, children and young people should be part of reflection in and on. But again, this requires a personal investment of self, a vulnerability in putting ourselves in a space where we are open and flexible to hear what children are experiencing in the moment. Furthermore, we can often think about critical reflexivity on practice being the same as some sort of introspection of the self. And while that's foundational to social work, we give less attention to critique of the collective system function. We're often seen as practitioners not in our role, and that this is something more taken up by management or funders or government. But I suggest here that critical reflection, both in and on, should be individual, collective, and done with children and young people. Finally, my last point is about normalising collective risk. And we have so much data on child protection. And I'll take just one example, which I know is common across systems, where there are child death review teams, for example. And I use these in my teaching for students to reflect on the process, to draw out interactions between structure and context and stakeholder. And they do this in groups to determine where there was no ingestion of the child's view or digestion of what that meant, or then absorption into other parts of the system where their voices were being part of the decision-making process. So just to summarise, mitigating the burden of decision-making is a key barrier to operationalising children's participation in child protection. And I just want to recap, I guess, what I've really been talking about here, which is comparing complexity absorption with complexity reduction. And you can see there are some quite distinct and opposing, almost binary ways of approaching child protection work when we take this complexity absorption approach. Complexity absorption is about collective endeavours, but it is very much also about utilising the risk. So it's not about coming together to reduce the complexity, but to actually understand and, as we said, gain energy from the diversity of responses, from the complexity. It's about enhancing the quality of the decision making by mitigating the anxiety and the burden of what will always be very difficult, large quantities with grave consequences. It's about fostering inclusive practices and really articulating all of the stakeholders in the system and not prioritising only a few. It is very much about empowering children's voices. And this is really the strength of a complexity theory informed approach in terms of children's participation. Children's voices are essential in the feedback loops and in the ways in which we engage with each other to protect them. It very much encourages adaptive strategies and doing that based on what is currently happening in real time. And this in and of itself can be anxiety provoking. But doing this collectively, as we said, distributes that burden of decision making. And of course, it supports holistic approaches because the system itself, as new ways of working are taken on, the system itself changes. And so it is a holistic change that can come about. I guess what I'd like to end with are these couple of questions. I know that systems in Ireland are very different to the context that I've described in Australia, but I'm very keen to hear about whether your system allows for dialogue that explores the epistemic differences about participation. In what ways does this occur, and how does this become a feedback loop into other parts of the system? But also, what are your experiences of complexity absorption? Some of the other ideas that I've mentioned there. In what ways do those actually normalize children's voices in the decisions that you make every day? So I think I will end there.
Okay, thank you very much, Samia, for a very interesting presentation. Can I now ask Dr. Caroline Duignan to respond? Thank you.
Thank you, Aisling, and thank you, Samia, for a very interesting contribution. There are so many different aspects that I would like to comment or respond on, but I'm going to frame my response in terms of 3 pillars based on my own practice and practice of Children and Young People Services Committees, based on my research, and based on my observations in relation to children's participation in the complex systems that many of you work in. Firstly, in relation to my current practice and CIPSI practice, I've coordinated Roscommon Children and Young People Services Committee for the last 10 years. Children and Young People Services Committees, or CIPSIs for short, were first piloted in Ireland in 4 areas across the country in 2007, and there is now national coverage for the initiative with 27 CIPSIs in existence. In my role, I'm responsible for bringing together a broad range of statutory, community and voluntary agencies to agree strategic actions in relation to the health and well-being of children and young people ranging in age from birth to 24 years. CIPSIs provide examples of the complex adaptive systems that Samia has described. They are fluid, continually in a state of flux and able to take on multiple states. Like all services, we've had to adapt to measures recently related to the COVID-19 pandemic and the war in Ukraine. We have done so by developing creative, flexible ways to support families through online interventions and supports, and, for example, developing packs to deliver to families based on themes such as play. CIPSIs put services into an adaptive, highly dynamic space, as referenced by Dr. Mary Albion in her contribution on leading in and through complexity earlier in this series. She says that at the core of an adaptive response is getting people together to try to understand how we can do things differently. And this is at the heart of what CIPSIs do. Also earlier in this series on the topic of complexity theory and public services, Dr. Fergal Lynch talked about the importance of communication, the importance of working with stakeholders and creating tighter linkages between government departments and stakeholders. And again, I would say that this is at the core of what CIPSIs do. As well as working in a collaborative way, we also work in a participatory way. We developed 3-year strategic children and young people's plans, which must be developed based on consultation with children and young people. This participatory methodology is named in CIPSI policy and influenced by the development of the participation of children and young people in decision-making strategy, which I'll discuss later on. In our meetings to prepare for this webinar, and as Samia has said, she has advised that there is no equivalent structure in Australia, and this surprised me. Because I see TUSLA staff achieving aims in relation to children's participation very well by using the 3 Houses tool, which of course has been adapted by TUSLA from Australia. But Samia, you had one really nice example in relation to Australia and having that structure of bringing people together, but perhaps that's a once-off as opposed to a whole of government approach. I would like now to move on to aspects of my research, which explored the operation of power structures, relations, and processes within the context of strategic collaborative working towards outcomes for children and young people. When I used the lens of power to explore the operation of SIPCs in Ireland, very interesting findings emerged. And Samia has referenced aspects of power also in her contribution. So key findings from my study show that power plays a significant role in the operation of strategic collaboration, but that the impact of it is not often considered, both by participants and in the literature. My study highlights different perspectives on power and influence in strategic collaboration, which are dependent and influenced by the professional and organisational contexts that members and leaders come from. So, for example, many of the community and voluntary sector participants in my study advised that their participation is sometimes framed within a consciousness of their positions of lesser power when compared to the larger statutory organisations who are members of SIPC, who have access to funding that the community and voluntary sector don't have. Positive aspects in relation to the productive nature of power with the collaborative structures are highlighted in the findings in the ways that SIPCs provide a context for getting things done and introducing new ways of working. The study stresses the significance of structural and organisational contexts in supporting participation, and further, the significance of aspects of personal power were emphasised. The study calls for attention to be paid to power structures, relations, and processes by practitioners and policymakers associated with SIPCs and other collaborative structures, which have as their focus well-being and outcomes for children and young people. It offers a preliminary framework to support participation for all in strategic collaborative processes. And one of my findings was that some study participants said the more they participated, the more powerful they felt, so the more their voices were heard. So that is a double-edged sword, really, because if you participate, your power increases, but then what happens to those who don't participate? And really linked as well to what Samia has said earlier about children's participation. So I offer recommendations in relation to the review of policy and practice for these structured collaborative processes, which acknowledges the role of power alongside consideration of the leadership model. I also suggest and comment on the importance of reflective practice and learning. So in conclusion to that research piece, I would say that looking at power and considering power in strategic collaborative contexts really would result in decision-making being distributed, as Samia has described. The final pillar of my response is based on my observations in relation to children's participation in the complex systems that many of you work in. I see on a daily basis children's participation in child welfare and protection. In Galway and Roscommon, children and young people over the age of 12 are always invited and supported to attend child protection conferences. And if they opt not to attend, their views are submitted to the conference in a variety of ways that suit them, either through for example, an advocate, or through working on a booklet called Me and My Meeting. Examples of children participating in decision-making in terms of service development and delivery abound. And in Roscommon, the Roma Youth Service is co-produced with children and young people who attend that service. and as a result, a service that strongly supports interests in sports and music exists. Another example is the Tusla building in Loughrea in County Galway, which has been designed and decorated with input by children and young people and offers them and us a bright, welcoming space as a result. And they are only two small examples of lots of similar examples around the country. I also see social work, social care and youth work staff in many different contexts experiencing stress and tension and the increasing complexity in relation to the work as Samia has described. I see those staff in many different contexts absorbing the complexity of the systems they are working in and the contexts they are responding to, while also engaging in participatory practice. I believe that this commitment to the right of children and young people to participate is really fostered in this country by a number of factors, including government policy. So the top-down and whole-of-government approach to participation, which started in earnest in 2015 with the publication of the National Strategy on Children and Young People's Participation in Decision-Making, has greatly helped the participation agenda in Ireland. And it ensures that there are no competing understandings of participation, that there is a uniform, standard, whole of government, top-down approach to an understanding of participation. I also feel that agency policy it has a huge influence as well. So I'm employed by Tusla, the Child and Family Agency in Ireland. It has its own participation strategy and associated participation training, and that provides staff with an opportunity to apply the principles of children's participatory practice as they are going through and participating in the training themselves. So very clear tools exist and are passed down in relation to participation. So because of all that, I really believe that we do in this country have significant expertise related to participation in complex systems. This provides us with the opportunity to provide leadership on how complexity absorption and participatory practice can coexist. So thank you very much.
So over to you, Carmel.
Thank you, Aisling, and a sincere thanks to Samia and Caroline. I must admit I've only come to complexity theory in recent years, but I really welcome all the attention to complexity theory and complexity absorption, and also the, I suppose, attention that we give now on a regular basis to power and to participation and all of the complexities involved in that. It's very refreshing, even from where we were kind of 10, 15 years ago. So we don't have any formal questions. Oh, sorry, we just actually, one has popped in. So I'm just going to read it now as I'm going. So the first question here gives thanks, obviously, for a very interesting presentation and response from Caroline. And a question for Caroline about children's voices being heard with the support of an advocate, and maybe to talk a little bit more about that in terms of, you know, whether they're independent advocates or who takes up that role. And then for Samia to follow on and answer whether or not you see a role for such advocates in that distributed kind of shared decision-making space. So kind of a part A and a part B to the question. If Caroline can tell us a little bit more about the advocates, and then if Samia could just talk about the role for those advocates in the distributed or shared decision-making space. And thanks for that question.
Thanks for that question, and a very interesting question. So in the context of child protection conferences across Galway and Roscommon, children are always invited to attend once they're over 12. If they feel that they don't want to participate, they do have an option of having their views heard. One of the ways they do that is that their views are reported in the social work report that is also presented at the conference. So the short answer to the question is that the advocate in that context may not be, or probably is not, independent, because staff in social work and social care are supporting the child to say their views. However, in the court system, I would say the majority of cases do have a guardian ad litem that expresses the child's views, and that is an independent person.
Thanks, Caroline. And I'll hand over to you, Samia, in terms of the role for those advocates in the shared decision-making space, and if you have any thoughts on that.
Yeah, I think it's a very important role, and generally when we talk about children and young people participating, we are talking about children over 12. And for children under 12, I think this is an area that we need to put in more effort and more consideration. And this sort of advocate for children under 12 may be a good way to go about that. Where they have maybe some intensive time to actually build relationship and rapport with the child, and very much be part of those distributed horizontal structures of decision making on behalf of the child. I think that's a very important role for the advocate in some of the ideas that I expressed there.
Indeed.
Can I just say as well, Carmel, that I have a really nice example from Roscommon on work I did with Dr. Marie Gibbons around consulting with 3.5 and 4-year-olds in relation to their needs, in relation to their health and well-being. And we have an early years policy in Roscommon based on the views of those 3.5 and 4-year-olds, and they were very well able to articulate their views. When we were able to adapt to and develop a consultation process that took their age into account.
Thanks, Caroline. Yeah, because I think there's kind of an appreciation around how to do participatory practice with the older child or the teenager, but still, I think, a little bit more daunting when you're thinking about very young children and how to best do that with them. Great, thank you both. So we have another question here asking if you could both speak to ways of articulating ambivalence and how and why to surface those issues. So I don't know, Sammy, if you want to go first, maybe to talk a little bit more about ambivalence, or...
Yes, certainly. The ambivalence, I think, is something that we are, as practitioners often hold in relation to performance, how we are, performing in our role. But it's important to recognize that articulating that ambivalence actually is best practice. It is part of the way we move forward in terms of building rapport with a child or young person, or having a conversation with another stakeholder. So being able to say, I am actually unsure about, or this is actually where I am, wanting to take more time to consider the decision, or where I'd like to hear other people's opinions, or where I'd like to, speak to the child over a period of time. There are often times where we do work with children and young people and we do ask their views, but we don't realize that time for children is very different to the way time is for adults. And so we get their view at a particular point in time. And it can just be a word or an action, or some other emotional response that they've had, or even just a poor night's sleep, and their view may change, and that children function very differently cognitively than adults. And so asking their view over periods of time is really important. And so I think it's okay, while we're doing that as practitioners, to say, I have some concerns, I'm uncertain, and that actually is the way I can express my best practice.
Yeah, I think that's very important, Samia. I think, given practitioners permission not to have all the answers and to know the perfect response at every point in time is really helpful for practitioners, to be able to, as you say, to kind of embrace that ambivalence. Caroline, did you want to come in there?
Yes, I just think that support of team members and colleagues is really important in terms of ambivalence as well. And again, I see those conversations going on all the time. So I think that working together as a team, maybe group supervision, and that's a really important way to support people who maybe aren't as confident in talking to, consulting with children as others. And again, I would say practice in that area is really, really positive, and that's what I see.
Mm-hmm. Yeah. And actually, we have another question here, which is very much, I think, following on from those points. So the question relates to practitioners, to the staff, I suppose, and really it's kind of a comment and a question to ask whether we should have participatory models built into staff team meetings and supervision sessions. So really to, I suppose, support an examination of process and outcomes by, by embracing that participatory model in those kind of more formal structures. So again, maybe if you just had a comment on that, and I think it's linked to that kind of reflection in and on action points that you were making earlier. So Samia, do you want to go first?
Yes, certainly. And I think that's, of course, essential that those models are utilized. They're obviously incredibly useful and are evidence-based. We can see the results of those sorts of models. But also extending that as we talk about complexity absorption, we're not talking just about practitioners. We are also we're talking about a whole system. So embedding those in supervision and team meetings, but also for policymakers, also for funders, for a range of stakeholders as opposed to just practitioners, because often that burden of decision making is because the focus is on the practitioner, but the system is not just practitioners, and so complexity absorption means that interconnected way. So using those models in a wider range of areas is important.
Yes, exactly. Yeah. Good reminder, Samia. Yeah. Caroline?
Yes, of course. I would say that discussion at team level, at county level, any context and all contexts, of course, that will support and drive a participatory methodology.
Yeah, indeed. Okay, I'm going to fit one last question in. The clock is ticking on, but I think we've time for one last one. So this question is to ask, can you both speak to why it's important to connect individual participation with structural and systemic participation? So again, it neatly follows on from your point there about broadening out those processes. So if either of you want to just take that one.
Carolyn, would you like to respond?
Yes, in my response, I feel I did say that I'm part of this wide structure that consists of statutory, community and voluntary organisations at a strategic level, supporting that structure and systemic participation. And obviously, I do think that's really important, and that support from the top down in terms of the government drive of SIPCs and other strategic structures is really important to drive participation, to acknowledge the complexity and support working with and through complexity.
Indeed. Thanks, Caroline. Samia, I'll leave the last comment to you.
Yes, I think the individual must be connected with the structure. Otherwise, they don't understand the context in which they work, and you can't do complexity absorption without understanding those structures and the role that you play within them. So I'll leave it at that.
Great, thank you, and thanks to everyone for the very interesting but also very related questions there, so thanks for that. So I think I hand over to Aisling to wrap up, so thank you again.
Thank you very much, Carmel. Thank you very much, Samia and Caroline, for what I think was a very interesting and absorbing conversation on complexity theory and children's participation. I think we've had a very interesting kind of practitioner kind of. I'm really thinking through the complexity absorption piece, Samia, from your presentation, and thinking through my digestive system. Will be a very different experience, because I actually think it's a very interesting way to think about ingesting, digesting, absorbing, transferring. It's a very interesting way to think about participatory practice, and certainly I'll reflect on that. And I think just the contextual piece, Caroline, in terms of the efforts made in an Irish context around children's participation are very significant. And it really is ensuring that we really kind of continue to develop and continue to move in terms of the depth of the work that we're doing in relation to children's participation, both at the individual level, but also at the connecting of that voice into strategy and policy as we move forward, I think is critically important as well. And there are significant kind of efforts in that regard, which are very evidence supported, top down and bottom up, as you've described very well. So thank you both very much. Samia, we'll be delighted to let you get to your bed, because we're aware it's early morning now, Thursday morning in Australia, and we're hugely appreciative of your time in joining us at such a kind of an unhealthy time for yourself, but it was a very healthy presentation. So thank you both very much, and thanks to our audience, thanks to Carmel and to Gillian for the huge work she does in organising these webinars. So till the next one, folks, thank you very much.